Hi, everyone. Today we have a wonderful co-author spotlight of the book, How Healers Heal. We have Dr. Simran Malhotra. Hi, Dr. Simran.
Hey, Shilpi, thank you so much for having me.
I'm so excited you're part of our book and your story is just so powerful, so impactful. Let's learn a little bit about you. Can you tell us a little bit about yourself?
Well, first and foremost, I'm a mom of two. My son just turned 5, my daughter 6.5. I'm originally Canadian, moved to Maryland for my medical residency, met my husband, and this was in 2012. The rest is history. We're married, have 2 kids, 1 cat, a dog, and yeah, right now I'm working as a part-time palliative care inpatient doctor. And then I have a lot of interests and a lot of different ways that I've grown over the past 8 years, which we can get into.
Amazing. Well, I don't want to give away your chapter at all because it's so impactful, but tell us a little bit about how you got introduced to lifestyle medicine.
So lifestyle medicine actually found me when I became the patient. So going back, rewinding to when I was a kid, cancer and I were introduced pretty young. My mom was 33 when she was diagnosed with breast cancer. The first time I was 13 years old. And subsequently through the years, many more women on my mom's side of the family were diagnosed with either breast or ovarian cancer. Many times, like, I never heard about these stories because many of them are back in India, and like, in the Indian culture, we don't talk about disease and cancer and death. And so it was always a very vague story. So it kind of always got swept under the rug until 2014, when another incident happened. Someone got diagnosed, someone very close to us. At this point, I was in my residency, and I told my mom, was like, there's something wrong. Like, this isn't right. And I encouraged her to get genetic testing again. She got it initially, but got it again. And this time found out she carried the BRCA1 mutation. I'm going to try not to like give the whole chapter away, but basically fast forward, I ended up getting tested. I found out I was BRCA1 positive. I was 26 years old. I was in residency, just about to start my fellowship in hospice and palliative care. It was this crazy dance of like being a patient and, having an oncology team and a whole group of people basically telling me like I needed to have my children. I needed to, get surgeries preventatively. I needed to do all of these things in such a short period of time because they wanted me to have my surgeries before my mom's age of diagnosis, which was 33. And at the same time, I was like walking into this world of palliative care, and the hospital I was working at had a lot of really young patients with advanced cancers. So it was a very like challenging time in my life. There was a lot of fear, a lot of anxiety. I was also on a visa, so I wasn't able to just stop and take a break and take care of myself. I like had to work, and I had to do this for like 3-4 years straight without like any choice. So it was a very challenging time for me. It was always like, okay, doctors, like, what else can I do? And I always got radio silence. Like, no one was ever able to empower me with anything I could do in my everyday life, until one day I had a patient who like struck a chord with me. She said something and it just totally changed the trajectory of my life. I ended up finding Dr. Michael Greger and picked up his book, and yeah, the rest is history. I found lifestyle medicine found me. It changed my life, it changed my husband's life, it changed, my future children, my current children's lives, my mom's life, so many of my friends, and now patients, clients. It's been a life-changing experience. So that's where I'm at. I think without giving away all the details of the chapter.
Wow. I mean, I just get my breath taken away every time I read your chapter or think about your story because it's so impactful. That must have been so hard. But to clarify for the general population that might be watching, you were planning on having surgery because of the positive genetics, not because you had breast cancer.
Correct. So With this genetic mutation, it's the one that Angelina Jolie had a few years ago. She like went public. She preventatively got a double mastectomy. And so for me, it was like, because of my family history, 9 women, my mom ended up getting cancer again 15 years later. So she's a 2-time breast cancer survivor. And so, yeah, the 9 women, 6 have passed. So because of that, like intense family history, and my lifetime risk being 87% for breast cancer and 40 to 50% for ovarian cancer, the medical team was basically, you basically really need to get these preventative surgeries. So they gave me like a 5, 6, 7 year period where I needed to do aggressive screening because I needed to have my kids and like do all the finish residency, do all the things before I had surgery. So fast forward to 2020 is, I was done having my kids, I was done breastfeeding, doing all the things I needed to do, and ended up having, at the height of COVID, ended up having a preventative bilateral mastectomy and a total hysterectomy at the age of 32. That was a very wild year, practicing palliative care in COVID, married to a critical care doctor, having major surgery with little kids. It was a year that I think I'm still processing.
That's just phenomenal. I mean, I don't know how you're doing it. It's just mind-boggling. I can't even wrap my mind around everything that you've experienced, kind of living your life in a kind of like a bucket list of life essentials, not thrilling things, to get done in like 5, 7 years. Wow. Oh my gosh. I feel like I need a breather meditation when talking to you. Okay, so I'm going to switch gears a little bit because I want people to read your chapter and reach out to you and connect with you. But how do you use lifestyle medicine in your practice today?
So many different things happened after I had my surgeries. I was probably at one of the lowest points in my life. And even though I had found lifestyle medicine, I had, embraced a plant-based diet, all of that, I was still like very much in autopilot with the rest of my life because I was in early motherhood, had 2 kids, 18 months apart, and it was just crazy. So after my surgeries, I had a major complication that was unexpected and ended up in a pretty deconditioned state where I needed a lot of support from my husband for quite a few weeks. And this sparked a whole nother thing in me where I was like, okay, this can like never happen to me again, as much as I can control. And so then I really dove into even more of like, I got board certified in lifestyle medicine. I ended up wanting to really understand the psychology and the mindset behind lifestyle change. So I ended up going in and becoming a certified health and wellness coach, a culinary coach, and like just trying to figure out like, okay, unraveling like, how did I do everything I did despite all the chaos that was happening in my life? And what I ended up figuring out was like, it's possible when you have the right mindset. Like everything comes down to your state and your mindset, and wellness is a mindset. And then I was like, okay, I need to share this with other people. And so my patient population is very, very sick, oftentimes near the end of life. So this was not the right place for them. So I ended up going and founding Wellness by Lifestyle MD, which is my coaching practice. And I only take a very small number of coaching clients at a time because my life is just in a very busy season right now. So I have that. I'm coaching, doing lifestyle mindset coaching. And then I'm also kind of in the middle of trying to figure out where I'm going with my clinical medicine career. I might have some pretty cool opportunities to incorporate lifestyle medicine into my clinical practice. So we'll see where that takes me. But right now, in terms of for the general population, I have my coaching practice, but again, very like small handful of people that I'm coaching at a time.
I'm sure they're thankful you're doing that. I don't know. I mean, you are just so incredibly strong. So in all of this, you're getting certified in multiple things, including the board certification for lifestyle medicine, which is not an easy exam.
I took the exam 6 weeks after my surgeries. I don't know what I was thinking. That not a good idea, but I think it was just for me. I needed something because I was mostly in a recliner for almost 8 weeks, and so I needed something to like, take me to the next step. And that, like, I don't know, lifestyle medicine just does that to you and for you. I think, especially when you're a burnt out doctor, it like gives you that zest back for life and kind of reminds you of why you went into medicine in the first place. And I don't know about you, but I feel like for most of the doctors or medical professionals I know that went into lifestyle medicine, they were the patient first. So they like, used all the principles that we learn on themselves first, and then the ripple effect in their family and their communities. And then they bring it to clinical practice or to a clientele or whatever. So it's just such a transformative field of medicine, I think, especially right now where burnout is so high.
That was true for me for sure, and I think a lot of us in the book. So let's switch gears to the book a little bit. Why do you think doctors or patients or other people should read this book, How Healers Heal?
So I'll give it to you. I'll give you my answer from the patient's perspective again. In 2020, before my surgeries, I joined an online community of women, and it was mostly young women between 20 and 40. They were, a lot of them were in the breast cancer community. So they were previvors like me, so people who had a genetic mutation but not yet had cancer. They were people going through cancer survivors, and then caregivers of people who, were caring for people with cancer. So I joined this online community because I really needed to talk to people like me who were going through what I was going through. The doctors were great. They're the experts in disease state and disease management, but they don't get the patient perspective unless you become the patient. It is wildly different. And the crazy part about me joining this group was every support, like, and this at this point it was 2020, right? So everything was online on Zoom. But every like group I sat in, almost every single person, not every single person, but many times, many of them would say, like, especially if they've been through cancer treatment, I wish there was, something about like what I can eat or how much exercise I need to do, or like, like some sort of like community support within the cancer centers. Like, and so, I was hearing all these tidbits of different things that people needed. And like, crazy enough, they all fall into the different pillars of lifestyle medicine. And so I think it's just something that most doctors like you and I were not trained in medical school. It's something that we fall into later on into our career. And it's something that I think almost every single patient, including myself, looks for, because it is the simplest things that we do every day in our life that we can actually control. And so it's so empowering. So I think these are all these, the doctors, there's 33 women in this, in this book. They're all doctors. They all came to lifestyle medicine from different roads and paths. And I think every single one of their stories is incredibly inspirational. And I think not only will it be amazing for patients to read, to see that there are doctors going down this path, and it'll also be amazing for doctors who are thinking about it, and they can see how it can change their life. And then, again, on and so forth into their communities and their patients. So I think it could help, patients and doctors.
Thank you. I mean, I agree. This group that you're talking about with the women, is it a lifestyle medicine group? Did it become a lifestyle medicine group?
No, sorry. So this is actually an online support group for like people in the cancer community. So I went there as a patient, but what I was just hearing from these other women who were either, had preventative surgeries like me, or were going through cancer treatment or whatever, like they were all looking for essentially the things that they could control in their life, which comes down to really the different pillars of lifestyle medicine, right? Like the food we're eating, the way we're moving, the quality of sleep we're getting, the people we're surrounding ourselves with, the thoughts we're having, like, but these are all the things that we don't really talk about in traditional medicine for so many reasons. But I think mainly that we were just never trained in the evidence base of lifestyle medicine, yet it's what patients crave the most. The simple, actionable, evidence-based lifestyle habits that we can use to empower ourselves, especially when you're feeling like you're in a helpless situation or when your control has been taken away. Because when you're a patient, there's so much you have to give up in terms of like your autonomy and the way you want things done, when you want things done, dealing with insurance, all the tests, all the blood, like it's just so much. And so I think lifestyle is just, it gives you back that control,
I like how you phrase that. Yes. I mean, it does. It's so overwhelming to be the patient. Okay. Well, I know you have limited time, so thank you for that. Couple more questions. What is your number one takeaway for lifestyle change for someone while they're waiting to get their copy of the book in the mail or
So
self-care?
two things. As a palliative care physician who has taken care of the sickest people with serious illness, oftentimes nearing the end of this physical life, I can tell you that some of their greatest regrets were around not taking the time to take care of their bodies. And so what I would say is, don't let perfection be the enemy of your progress. Progress is everything in life. So, you don't have to, even though the recommendation is 150 minutes of, moderate intensity exercise of, aerobic exercise per week. If that's not where you're at in this season of your life, that's okay. So start with 10 minutes, once a week, 10 minutes, twice a week, do whatever you can, but know that those small, simple actions that you take every day are going to build up. And when you look back, they're going to make a huge impact in your, not just your quality of life, but also your longevity and your, reducing your risk of chronic disease, and living well into the later years of our life, because that's really where we end up seeing so much of, the suffering. So that's what I would say. Don't let perfection be the enemy of your progress, and your wellness is a mindset. So it starts up here first. If you can convince this mind up here, then your body will follow.
I love that. Those are great. And then is there anything else you want to say that I haven't asked you about, and any other ways to connect with you?
I think the only other piece I would add to that is that it's never too late. So don't feel like you're too old to start. Today's the youngest you're ever going to be. So today's a good day to start doing anything you want to do to be healthier. And if you want to connect with me, I'm on Instagram at drsimran.malhotra. And I'm pretty active there. I'm not really active everywhere else. So, and then I have my website, wellnessbylifestylemd.com. And if you're interested in coaching or anything like that, you can check it out on my website.
Thank you so much, Dr. Malhotra, and thank you for your time, and hope people will reach out to you and learn from your incredible story. Thank you.
Thanks, you.